Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the heparin anticoagulant. Heparin is given by injection or drip into a vein intravenously or by injection under the skin subcutaneously for the treatment and prevention. It is derived from the porcine intestinal mucosa standardized for the anticoagulant activity. Heparin work by inhibiting the three major clotting factors, that is thrombin, thromboplastin and prothrombin. It shows the process of the thromboplastin synthesis, deaccelerate the conversion of the prothrombin to thrombin and inhibit the effect of the thrombin on fibrinogen blocking its conversion to fibrin. The agent also causes an increase in the number of the negatively charged ion in the vascular walls which help to prevent the formation of intravascular clots. Low molecular weight heparin. Low molecular weight heparin is gradually replacing heparin for treatment of most patients with the venous thromboembolism and acute coronary syndromes because it has more convenient and cost effective. It has a similar result to heparin and administered by the subcutaneous injection. Levodopa is an example. There are fondaparinux and fondaparinux is given via the injections once daily. It is licensed for the initial treatment of the deep vein thrombosis, that is the DVT, and pulmonary embolisms PEE, and for the venous thromboembolisms, their prevention in the patients undergoing surgery for the hip fracture or the hip knee replacement. Next is the history of anticoagulants. In 1960, D.W. Barrett and S.C. Jordan performed the first randomized trial showing the efficacy of anticoagulant therapy in the treatment of venous thromboembolism. Since then, important therapeutic advances have been made in the treatment of deep venous thrombosis, that is the DVT, and pulmonary embolism. Warfarin has been the drug of choice for the prevention and treatment of arterial and venous thrombotic disorder for more than 40 years. It has initially marketed as a pesticide against rat and the mice, and it is still popular for this purpose. The Zamigatran was the first oral direct thrombin inhibitor, had proven the efficacy for prevention and treatment of VTE, stroke prevention with the AF, and recurrent coronary event after acute myocardial infarction. It was the initially approved for the short-term VTE prevention in patients undergoing the orthopedic surgery in Europe. It was withdrawn by the AstraZeneca in the 2006 due to the lab works confirming the significant damage to the liver. The future for the anticoagulant. Limitations of warfarin have fostered a great interest in the development of the novel anticoagulants for the oral use of the potentially replacement warfarin. The design of the specific inhibitors against molecular target that play the pivotal role in the coagulation cascade are in development. There are the molecular target are the factor II-A, thrombin, and factor Xa. The two candidate compound, one direct thrombin inhibitor and one direct factor the 10A inhibitor, are the hoping to be approved as a new oral anticoagulant in new future. Factor 10A is an attractive target for the design of new oral anticoagulant because of the unique role that factors 10A play in the coagulation cascade as a connections between the extrinsic and the intrinsic pathway. Factor 10A also regulates the thrombin generation via binding to factor 5A, followed by the activation of prothrombin to thrombin. We can see in the following picture. It is the hypothesized that anticoagulant targeting factor 10A might be the more effective than those targeting coagulation factor locating lower down in the cascade such as the thrombin. This concept has been partially proved when the first indirect factor 10A inhibitor, the found Prexnux, received the FDA approval for the prevention and treatment of the VTE. So, in today's class, I discuss about the following anticoagulant properties, their future history. Thank you for watching.